Hi Jeremy, I'm just going to wash my hands really quick. Hi Jeremy, my name's Holly. I'm going to be your nurse today.
How you doing?
I'm okay. Can you tell me a little bit about what brought you in today?
I haven't been feeling good at all. Really bad stomach pains, kind of been feeling bloated and gassy and having kind of like a fever once in a while.
Okay, and with your fever, is there any like vomiting or?
No, I haven't been really vomiting.
Okay, is there anything you've done to make it better or worse? Where does it hurt the most?
Not really much to make it better or worse, and it really hurts the most, I think, right up in here, this area.
Okay, so that would be your right upper quadrant. Okay, Jeremy, well, upon general inspection, I noticed that your scleras of your eyes are kind of yellow. Your skin's looking a little bit yellow, too. Do you think this has something to do with your nausea?
I don't know.
Okay.
I know it's been going on for about a month.
Okay, so that's about when the yellowing started?
Yeah.
Okay. Have you taken any medications?
No medications.
Okay, and what about, do you drink alcohol?
I do.
Okay, and about how much do you drink a day?
At least a couple beers.
Okay. Well, and about for how long? You're pretty young.
Maybe 5 years.
Okay, so for about 5 years. Okay, my next question, Jeremy, is what about a family history? Do you have any family history of maybe hepatitis or any kind of abdominal problems?
No, not that I can think of.
Okay, and environmental too. What about your workplace? Is there any environmental hazards, like breathing in any chemicals or?
No, nothing like that.
Okay. Have you traveled outside the United States or drink any unclean water?
No.
By chance?
I don't think so. No unclean water. I haven't traveled outside the United States.
Okay, well, I noticed too you're not having any trouble speaking to me. At times now when you have this pain you're telling me about, do you have difficulty breathing at all?
A little bit.
Okay. Well, Jeremy, is it like at night that you're having the pain that is...
There's no certain time. It just happens.
Okay, and the difficulty breathing, is that with the pain or what?
Yeah, it's with the pain. It just happens at a certain time of day.
Okay. Well, what I want to do first is I want to do some vital signs on you. Your pulse was kind of high. I just want to take a listen to your heart. Okay, I'm hearing a little bit of an irregularity. I'm hearing an S3 and an S4 sound. Don't be worried. It's just giving me a clue into what's going on here. Okay, Jeremy. What I want to do next, because you have such a high pulse rate, is I'm just going to take your blood pressure. Okay, Jeremy, your blood pressure is about 145 over 105, which is pretty high. Have you had any dizziness or anything?
A couple times, yeah, and started about maybe 4 times or maybe 6 times in the last month.
Okay, and have you been able to sit down when that happens?
Yeah.
Okay. Well, that's not good. We have to figure this out. Let me take a listen to your lung sounds, Jeremy. You said you've been having a little bit of difficulty breathing. I just want you to take a couple deep breaths if you could. Well, your lung sounds are pretty clear, diminished at the bases. Um, what I want to ask you next is, what about your extremities? Upon inspection, I noticed that it looks like you have a little bit of fluid retention going on.
My legs have been feeling kind of heavy and sore. My arms have kind of hurt too.
Okay, I'm just going to take a peek and do a little bit of pressure here just to see. And I see edema, but it's non-pitting. It's kind of make your legs feel heavy.
Yeah.
Yeah, like you're carrying around extra weight. Okay, well, we definitely have some fluid retention going on. Jeremy, what I want to ask you now is if you can lay back for me so I can take a look. I want to take a look at your abdomen, and I also want to check your neck. What I'm going to do is I'm just going to check for any jugular vein distension. Okay, I'm going to have you turn your head to the left. Shine my light right here. Okay, jugular vein distension noted. Pulsations felt. I'm going to have you turn your head to the right, Jeremy. Pulsations noted. Okay, Jeremy, what I want to do next is I just want to take a look at your abdomen. I'm going to ask you to lift your shirt up. Okay, we have general appearance of distension. I see why you're feeling bloated and gassy. Is there anything you do when you feel bloated or gassy to relieve it? Have you been having any gas, pressure?
I have been, like I said, bloated and gassy. I kind of just lay down and quit moving around, I guess, when I feel the tension. It kind of helps.
Okay. That makes sense. What I'm going to do next, Jeremy, is I want to take a listen, okay? I'm just going to listen in all 4 quadrants. You said you had right upper quadrant pain, so if this hurts, let me know. Bowel sounds are not present, so in this case, I would listen to each quadrant for 5 minutes, which for this scenario I am doing. When was the last time you had a bowel movement, Jeremy?
A day ago.
A day ago? And can you tell me a little bit about the consistency or color? Was it a normal color?
It was kind of like a chalky brownish gray.
Okay. So would you say it was like almost like a clay colored?
Yeah, that's a good way to describe it. It's clay.
Right now I'm just listening to your renal arteries, and I do hear a little bit of turbulent blood flow. I'm going down here to listen to your iliac arteries. And then your femoral. Okay, Jeremy, what I normally would do next is I would palpitate your belly real lightly, but because you're so distended, I don't want to move anything around. Okay, so what I want to do next is I'm going to percuss your abdomen, which I'm just going to tap very lightly. So let me know if this hurts you.
Okay.
Fluid shift noted. Dullness upon percussion. And you said it's your upper right quadrant. I'm just going to feel for your liver. I'm just really lightly palpitating it. You can feel the border. And it does feel enlarged. Okay, Jeremy, well, what I want to do is I'm just going to have you sit up, and I'm going to talk to you a little bit about what I think is going on. Okay, Jeremy, well, first when you told me you drank alcohol, that kind of clued me into a little bit about what's going on. You said you don't really have a family history, but what I think is that there's some cirrhosis of the liver going on. What that is there's scarring. It means your liver's not working right. So your liver is basically a filter, and we need that filter to be working right. Now, there are things you can personally do to change what's going on with your liver, such as, quit not drinking alcohol, you'd have to be abstinent from alcohol and changing things in your diet, such as salt intake. We have medications that'll treat for the fluid retention. Those are called loop diuretics. They help get rid of the water and the excess sodium, which is salt. And then there's always the option of, if it's too far along, for surgery. But I think that we're catching it right at the beginning, hopefully. As far as your distension goes, I've seen worse cases. So, but everyone's different. Everyone's different. Let's just hope we caught this at the beginning. And like I said, there's many treatment options. Do you have any questions or comments for me, or?
No.
Okay, well, I'm going to take note of all this, and if you think of anything, let me know. And the doctor will be in to see you soon.
Thank you.
Thank you, Jeremy.